I'm wondering, Martin, how common are neuroendocrine neoplasms?
Yeah, it's more common than you think. So when we talk about the neoplasm, we're talking about most commonly 6% of them are the gastrointestinal and pancreatic neuroendocrine tumors. 30% are lung neuroendocrine tumors, and 10% are from other parts of the body. They most commonly present at the age of around about 60. The incidence is said to be now around about between 6 and 8 per 100,000 population. So if we took the UK, where I am, the population of 60 million, that would be 4,000 new cases per year. But the very interesting aspect of it is that because they're generally slow growing, the prevalence is very much higher. It's up at around about 30 or 30 plus per 100,000 population, which would mean that in the UK, there are 18 to 20,000 patients living at any one time with a neuroendocrine tumor, which actually means that's more common than pancreatic cancer and patients with myeloma who are in the populations.
Do you think that their use may have some common side effects among the patients?
When we talk about somatostatin analogs, Mehmet, in general, and most patients tolerate these injections very well. They are depot formulations given every month, and they may cause a little bit of discomfort at the site of injection, but this is usually fairly mild. And over time, and as people get experience with injecting themselves or getting injections in the general practice, this usually is not a big problem. On commencing treatments, patients may experience crampy abdominal pains or bloating with diarrhea or constipation. This is due to the side effect of slowing the bowel transit. One of the effects of somatostatin is to slow down intestinal transit. But once again, these symptoms usually improve fairly rapidly over time, and it's important to try to explain this to patients just at the start of the treatment.
PRRT, is that generally well tolerated?
PRT is generally well tolerated. There used to be problems with nausea and vomiting, but with the addition of amino acids and new agents of amino acids, that has been less and less of a problem. One of the bigger issues of PRT is sometimes the radiation safety, being able to have a dedicated bathroom, having some space while you're still emitting radiation. So that can be one of the things to be aware of with PRT. We do know that in the long run, there is a rate of myelodysplasia and even leukemia with PRT, generally thought to be somewhere in the rate of 1%, but still, that is a side effect that we need to be aware of.